Okay, so tell me a little bit about yourself and how you got involved in occupational therapy.
Oh, thank you so much for asking that question. Yeah, so my name's Josie, and I was born with a neurotype that we didn't really know about until just very recently. So I was most likely born with what can be called nonverbal learning disability or developmental visual spatial disability, which is kind of like the opposite of dyslexia in some ways. We're still learning a lot about it. But the best guess that we have at this time is it's a challenge of visual spatial processing. So the part of my brain that takes in visual spatial processing, which is usually on the right side of the brain, has trouble communicating that information accurately to the left side of the brain. And so the way that my brain works is it takes visual spatial information and it converts it into left brain language to try to kind of figure it out. So um that what that kind of looks like growing up is it's called like hyperlexia, where you're very early to gain language. So I started putting small sentences together as early as 9 months old, because without visual spatial data, it kind of limits how your body knows how to navigate a room easily, and it makes it more challenging to do motor planning things. So when I was born, so as I grew up, I struggled with things like handwriting, very clumsy. Um, I probably really needed an occupational therapist, but it wouldn't have been available to someone like me and in the age range that was there. So I think I stumbled upon occupational therapy in some ways similar to folks that take psychology courses where they didn't get access to therapy growing up. And then it's important to me to also express that the reason I knew what occupational therapy is because my closest cousin was born with Rett syndrome, which is a chromosomal condition that also limited her motor development. However, um, we had, so Libby, my cousin, she's my closest cousin, she didn't have the opportunity to develop language skills. So she was my favorite cousin, and we played together all the time. And I got to go to therapy sessions with her when I was 10, and she was in birth to three services. And playing with her there is how I learned what occupational therapy was. And she started my lifelong passion for supporting the needs and humanity for folks that are nonverbal. My disability blessed me with a voice. I have challenges in other areas. So I try to use my gifts and use my voice to partner with others in the disability community to create policy solutions that really can support all human beings and research practices that can support all human beings. So I'm very passionate from these early experiences, and I'm excited to work with somebody like you because I think that the disability rights movement could be made even more inclusive today. And I think we need to learn a little bit from our disability rights ancestors and start building partnerships across different types of disabilities and not just centering certain diagnoses, but thinking about how we can collaborate to take on practical challenges and barriers so that we can all live well together in a human ecosystem. And that's why I love occupational therapy, occupational science, and I hope that plants some seeds to answer your question.
Mm-hmm. Oh yeah, it's fascinating. So what sorts of things do you work on in occupational science, occupational therapy?
Yes, thank you for answering that question. And I'm doing my best right now to try to integrate both of those things. In January of 2023, this year, I was very fortunate to graduate from the University of Utah with what's called my post professional doctorate in occupational therapy. Like many people who are neurodivergent, I faced a lot of challenges throughout my education. I went to K through 12 school across 3 different states and went to about 12 different schools before I graduated high school. And I kept that up, I guess, in my undergrad of just keeping to try to explore to see if I could understand things a little bit better. And I guess I was really interested to go back to school to get my doctorate because I was really discouraged by many of the social structures here in the United States. Our healthcare system and social services system, as I'm sure you've talked about on this podcast, are very exclusive, and they're only available to people with financial privileges. And we still have a lot of work to do to make disability support services less harmful. So, being involved in going back to my doctorate, I wanted to try to find solutions and find sparks of hope of where we can start to build, better systems that are more accessible in a lot of different contexts. And occupational science is a way of studying about how our current social systems aren't very inclusive or accessible, and they encourage us to build collaborative research opportunities with the communities that we're trying to support so that we can create solutions that genuinely help and are less likely to repattern harmful effects like ableism or eugenics, for example. If you look around, you can still find ways that we are still continuing those practices today. And so we need to do better research and we need to partner with communities better. So right now, the focus of my degree was to try to find applied occupational science and to make sure we can share this with better communities and that clinicians are partnering with the communities that we support and listening so that we can really try to make gains to help these systems do what they could do but aren't doing yet.
Mm-hmm. Yeah. My next question here is, what sorts of things do you do to when you're like, what sorts of things do you do when you're looking for that? What sorts of things do you look for when looking at whether a patient is how you can make them, be more independent and do tasks on their own? What tools and strategies do you use?
Certainly. So, one of the biggest tools that I use is the Occupational Therapy Practice Framework, fourth edition. So, every 5 years in occupational therapy, we have a document that's kind of like, in a way, it's kind of like our constitution. It's like a little bit like the Diagnostic and Statistical Manual. But what it does is it outlines a process that occupational therapy practitioners can go through with clients to help support the client that we're working with on their goals. And the way that this tool is set up is we start by creating an occupational profile or an occupational history. And occupations are the things that we do every day that give us meaning and purpose in our life. And they're different for every single person because every person has a different history, a different context, and different things that matter to them. So when I start my session, I'm going to look at creating what's called like an occupational history or an occupational profile with my client. And I really can only put that together with the client and them sharing with me what they feel safe sharing with me. So I would ask them similar questions like you asked me about, what brought me here into the office today? What is your interest in looking at working with an occupational therapist? And I would ask questions about where did you grow up? When did you find out about your disability? what things are going well in your life right now and what things are challenging. We would look at kind of what a typical day and a week in your life looks like and try to identify where you're wanting to um, have greater ease, less barriers, and we would look at, both a social model of disability and a medical model of disability and a mental health model of disability as well. So sometimes the things that are a barrier for us and the things that we want to do, they can be kind of inside our mind and can be part of like internalized ableism, or they can be a sense of feeling overwhelmed and can be related to sensory barriers. Other times they're external barriers, like the environment is too loud, or it's not accessible via wheelchair, or maybe the people in the environment are creating a space that's unwelcoming. So first we got to understand what it is you're wanting to do and why it is there's a barrier to it. And then we can kind of collaboratively problem solve together solutions where we can adapt what you want to do, we can adapt the environment, or we can look at what's even within ourselves sometimes that's a barrier. So I love that about the occupational therapy practice framework is it gives us a guideline to work with our clients and to partner to find solutions that will work with you and the person I'm working with. I mean, general you. We really are trying to be more client centered. So that's my favorite tool to utilize, especially building the occupational profile, because sometimes it's good to just get to understand, the context that people are navigating in. And it's helpful to understand the past, the present, while also being open to more positive things coming through in the future and being open to not just seeing barriers, but also opportunities for helpful change that can come through by working together. As a therapist, I think we're supposed to help things change in a way that can really be constructive.
Mm-hmm. Yeah. Are there any particular kind of stakeholders that you work with in your occupation in particular?
Certainly. I currently work in post-acute care in my full-time job as a clinician in what's called a skilled nursing facility. And most humans throughout their life are likely to receive services in a skilled nursing facility at some point in their time as a human in the United States. It's very common as individuals age to require things like joint replacement surgeries or to have a heart attack or a stroke, for example. That's why often I really appreciate that the disability rights movement helps make more people aware that disability is an experience that all humans are likely to interact with throughout their life, which is why it's important that every human be an active stakeholder in terms of creating policies and social systems that are accessible to people with disabilities, because most of us are temporarily able-bodied and we all need supports for accessibility at different points in the lifespan. So, in my current role as an occupational therapist in a skilled nursing facility, I work actively with many members of the allied healthcare team, including nursing staff, medical personnel such as nurse practitioners, physician's assistants, medical doctors, dietitians, social workers, activity staff, janitorial care staff. We work with families together. When you work with somebody who has admitted to the hospital, you're not just working with the client, you're working with the full family system. And you're working with community stakeholders to make sure that people have secure places to live after their medical condition is stabilized. So we need to work with fire departments. We work with assisted living, independent living care staff. I really probably work with hundreds of people every week to try to make sure that people with disabilities can be safe in the community after they admit to the hospital.
Mm-hmm. Lastly, how can occupational therapy, like help a patient live the best quality of life, make a difference? Yeah, and occupational science because that's what you sort of focus in.
That's my goal going into these next couple years. There's still a lot of work to do. And right now, occupational science, it's a very exclusive science. It's very difficult for people to access, and not just for clinicians, but most importantly, for the clients that receive our services. So I look forward to hopefully being part of that solution and building community networks and finding new ways to share research and to connect with community members outside of formal publishing. So I'm really looking forward to getting efforts like that off the ground and networking with people like you to help make a lot of work more accessible. And I'm trying to circle back and remember your question about how occupational therapy can help. Is that right?
Uh-huh. Yeah.
So I want to acknowledge that there are many instances in our history where occupational therapy services have not always been holistic and supportive. There's a lot of change that needs to happen in the culture of occupational therapy service delivery, because often occupational therapy is only accessible to people from families where they have access to financial resources. Occupational therapy is currently not very accessible to people on Medicaid benefits or with mental and behavioral health conditions. And so there is a lot of work to be done to make sure that occupational therapy as a profession is not reproducing ableism or normalizing or shaming people with disabilities, even subconsciously, just because we have been part of the medical system. Um, so I would love to share how occupational therapy can help you when you are working with a practitioner that is interested in disability justice and rights, and that are actively reflecting and working with the community to find shared solutions. So if you're somebody who's maybe received occupational therapy in the past, I think it's healthy to reflect on how it may have benefited you in positive ways, and I think it's okay to communicate if there's been ways that we still need to improve as a profession in honoring, many people receive occupational therapy when they have a disability in their childhood years, from birth to 3, just like my cousin Libby, or through the K through 12 system. So if you're a person with a disability that's received occupational therapy services and you think that there's some ways where our supports could have been made more holistic or more responsive to your needs, I want you to feel empowered to communicate about that and to give us active feedback on how our services can support you as an individual with a disability, because often we end up supporting the systems that we work with more, and that can have some harmful impacts, such as making people write with a utensil that isn't their preferred way of writing, or not allowing people to communicate in a diversity of different ways. I really want to encourage others in the disability community to reach out and to let us know directly how our services can be better and more healing and supportive for them, because we really can't grow and improve without your feedback and without you feeling heard, respected, and valued. So I hope that my services can be helpful to the clients that I work with, and like coming up with new ways to get dressed, how to plan your routines so that you have a good amount of balance and your sensory needs are met, your emotional needs and your mental health needs. But do know that we're still fighting every day to make sure that occupational therapy services are accessible, that they're holistic, and that they care about disability rights and justice issues just as much as health concerns. So we still have a lot of work to do, and that's why we really need to partner with everybody in the disability community to keep learning and growing and providing as best supports as we can in the years to come.
For sure. Yeah.